For the last 25 years, the clinical pharmaceutical treatment for erectile dysfunction has changed very little across the globe. We are essentially using the same technology we discovered in the late 1990s. Today, we have the famous blue pill molecules, Sildenafil, which is the active ingredient in Viagra, and Tadalafil, often known as the weekend pill, which can be used daily or on demand. These are, by far, the most known and utilized molecules in history for this condition. But today, I'm going to show you a promising evolution in this class of medication. It is a development so significant that it is already being called by many in the scientific community Viagra 2.0. If we look back at the last 3 decades since the 90s, vasodilators like Sildenafil, Tadalafil, and Vardenafil, which are all inhibitors of the enzyme phosphodiesterase type 5, completely revolutionized urology and sexual medicine. They changed the conversation. However, it is crucial to be honest about the reality of clinical practice. Despite their success, we still face 2 major challenges with these traditional medications. First, there is the latency time. This is the delay, the waiting period, between taking the pill and achieving the maximum effect of the medication. Second, and perhaps more problematic for many men, are the systemic side effects inherent to these drugs. These 2 factors are the primary reasons why so many patients eventually abandon treatment. They simply decide that the side effects, or the lack of spontaneity, aren't worth the result. And it is in this exact context that a new player has emerged, Simenafil. This is a new molecule, a promise designed to fill exactly these gaps left by current treatments. But what do the papers and studies conducted so far, which are all very recent, actually tell us? Unlike traditional compounds, Simenafil is classified as a 4th-generation inhibitor of phosphodiesterase type 5. This sounds like a lot of technical jargon, but from a biochemical and pharmacological point of view, it means something very specific. It was designed to have a selective affinity that is far superior to other molecules. But what does that actually mean for you in practice? Why does affinity or selectivity matter? When we use a medication that is less selective, like the 1st-generation drugs, it acts a bit like a shotgun. It hits the main target, which is the enzyme responsible for killing the erection, but it also hits other enzymes nearby. For example, older medications often block phosphodiesterase 1. When you block that enzyme, you get the unwanted effect of heart palpitations or tachycardia. Another enzyme that often gets caught in the crossfire by less selective medications is phosphodiesterase 6. When this enzyme is inhibited, it causes those famous visual alterations, where vision becomes blurry or takes on a bluish tint. Simenafil is different. It acts more like a sniper than a shotgun. It focuses almost exclusively on the enzyme phosphodiesterase 5, which is present in the cavernous bodies of the penis. That is where we effectively want the action to happen, causing vasodilation and increasing blood flow. Because it is so precise, it results in a more efficient erection with a lower therapeutic dose of the medication. We are talking about a molecule that optimizes the nitric oxide pathway, which is the main vasodilator linked to the erection mechanism, much more intensely and precisely than what we have been using until today. When we analyze the studies published recently, we can highlight 3 main pillars of advantage for this new drug. The first, and perhaps most exciting for users, is the speed of onset. In the clinical trials already conducted, specifically in Phase 2 and the beginning of Phase 3, Simenafil demonstrated an initial hemodynamic response, meaning actual vasodilation, in just 12 to 15 minutes. If you compare that to the standard timeline, that is almost half the average time it takes for traditional sildenafil to kick in. This drastically reduces the awkward waiting time and allows for much more natural flow in intimacy. The second advantage is the window of opportunity. Despite acting very fast, the half-life of this molecule, its availability in the body, has been optimized. It offers an efficient duration for the patient. This allows for greater spontaneity without the need for that rigid, rapid planning. It is a molecule engineered to last long enough for a good relationship, but without lingering in the system unnecessarily long. The third and major advantage is the tolerance profile. In a double-blind comparative study, the incidence of those classic annoying side effects was significantly lower. We are talking about headache and facial flushing, that redness in the face that gives away that you took something. These are the top complaints in the doctor's office. The data suggests Simenafil reduced these specific side effects by about 40% compared to first-generation treatments. That is a massive improvement in the quality of life for the patient. However, I need you to pay very close attention now. This molecule is still in the study phase. It is going through clinical trials, specifically transitioning through phase 3, and it has not yet been approved for public sale. One of the main benefits of this molecule is undoubtedly the safety profile, but because it is currently under rigorous review, we have to be patient. Simenafil represents what we call molecular refinement. It is pharmaceutical technology applied to make biology work more naturally. It isn't just about making things stronger. It's about making the process smoother and less uncomfortable. Now, before you go to the comments or search engines looking for where to buy this, understand this. This is not a medication you can find on the shelf yet. You will not find it in pharmacies in the US, Europe, or Brazil right now. As of late 2025, major regulatory bodies like the FDA and Anvisa are still minutely analyzing the long-term data. They need to be absolutely sure that while it is effective, it is also safe over long periods of use. So, please be careful. If you see Simenafil being sold online today, do not buy it. It is likely a pirated version, a counterfeit, or a scam. It is crucial to wait for the official release and the green light from health authorities. We are bringing this topic to you now to keep you on the cutting edge of sexual medicine. Simenafil is, without a doubt, a powerful new tool coming our way. But remember, the success of any treatment continues to depend exclusively on the correct diagnosis and a prescription made by your doctor. A pill, no matter how advanced, is just one part of the puzzle. We will continue to track the progress of this molecule throughout the coming year, and will bring you the news as soon as commercialization is authorized.